Hey, welcome back to my channel. Today we are talking all things pre and post care, Botox, filler. I've got you. So if you're coming in for Botox, that is when we're trying to treat wrinkles, expression, so mad face, like your frown lines, your horizontal forehead lines, around the eyes, we call them crow's feet. Or you might be coming for your masseters, your TMJ, like your jaw pain, clenching, headaches, grinding. Things that you want to know are that it's a potential you could bruise. So if you have some major event, you either plan this in advance, at least 2 weeks, or you can wait till after event. Beforehand, I want to make sure that you avoid blood thinners like aspirin, ibuprofen, fish oils, ginger, turmeric, garlic, and alcohol. Those are going to thin the blood out and make you more likely to bleed and bruise. So avoid those leading up to your appointment. I try to say like the very best is 1 to 2 weeks before. Additionally, if you can take arnica, this is an herbal supplement. You can find it at most health food stores. You can find it online. Eat some pineapple. If you take that leading up to the appointment, 1 to 2 weeks, having it in your system, it is also going to help minimize bruising and swelling. Also, before your appointment, I probably wouldn't drink any coffee. Hydrate, drink water, make sure you eat something before you come in so you don't have a low blood sugar. Okay, so with your filler, they want you to do the same pre-care. However, just be mindful that you can bruise and swell and it might last a little longer. So this one, depending on what you're prepping for, if you're trying to get ready for a big event, we want to do this, multiple weeks in advance. It might be months in advance if it's your wedding. So that one, there is a little bit more post-care, some healing that we have to be mindful of. Your Botox, like what you can expect with that is it takes about 2 weeks for the full effect. So as your Botox, remember the one for the wrinkles, as it's kicking in, it could look asymmetric, one side is working and the other isn't, and you might think my brow is up or down. So be mindful of that if you have events planned, for those 2 weeks that it's taking effect. Keep that in mind. Okay, so your pre-care, that's kind of it. Follow those instructions, come in, you're gonna be good to go. Post-care, there's some more with it, so let's get into that. Okay, so after you finish Botox, it's going to look like little bumps, like bee stings wherever we injected. That is normal. People always get nervous. Is this gonna go down? I have to walk around like this. So usually those little bumps come down about 10, 15, 20 minutes after your treatment. Normal, don't press on them, let it be. So for 4 hours after your injections, I want you to stay upright, don't go home, don't lay down flat, don't press on anything, don't put a hat on, don't go exercise. I don't want it moving from where we place it. So when we're doing Botox, we're targeting certain muscles and trying to weaken them. If you're rubbing it, you could potentially move it to muscles we aren't intending to treat and cause an outcome that we aren't hoping for. So just hands off. You can go back and exercise the next day. If you are bruised, you can keep taking your arnica, you can keep taking your pineapple, that will help, and keep avoiding those blood thinners and alcohol just to help not prolong your bruising. You can ice if that helps you. If you're feeling sore, you can take if you're feeling sore, you can take your arnica, you can take Tylenol. It shouldn't be this extreme pain thing. Sometimes as it's kicking in, a few days in, especially when it's like your first time, patients will say they might feel a headache as those muscles are not having their normal movement. Take Tylenol. It should not be this debilitating thing. It should be okay. So you can wash your face when you go home at night. Remember, I just don't want you rubbing super hard up here. I don't want you in the shower. I don't want you having a steam room. Heat can potentially move it if you're sweating, so let it be. Okay, so right after your filler, things are going to look exaggerated. You can be bruised, swollen. Again, all that is normal. Some people are loving it when it looks exaggerated because it might look a little bit more lifted, a little bit more projected. Other people are gonna be really nervous. So don't fall in love with this, don't hate it, it's going to change. What you'll notice in the next day or two is that the swelling will likely get worse. Again, normal. Don't freak out and don't fall in love with it because it's going to change. So first 2-3 days is the worst. From there, over the next 2 to 3 weeks, your filler continues to settle. You're gonna see it just getting less and less swollen, inflamed, and what it's kind of gonna look like. At around 2 to 3 weeks, you're gonna have a pretty good idea. However, I want you to keep in mind, it takes 6 to 8 weeks for the filler to completely settle, integrate, mesh in with your skin. So when we check in with you like 2 to 3 weeks later, most patients are like, I like it. However, I see, right here, I see a bump. If they make a weird face, that's normal. I say, if that little bump is still there when you're making that weird face, when I see you for your follow-up at 6 to 8 weeks, I'll dissolve it. What happens is when they come back, they're always like, that bump went down. So it's all a part of it. Give it time. Don't freak out. It will be getting less and less over that span. You don't need to do anything. You don't need to press it. You don't need to do anything extra. It will settle on its own. So when you go home after your filler, I want you to ice. The first 24, 48 hours is going to be really helpful with the swelling. Keep taking your arnica, your pineapple. That's going to help with your bruising and swelling. You can use our Recovery Boost Serum. That's also going to help hydrate, keep the skin clean. You can apply this twice a day. No makeup for at least 24 hours. So that we're not getting makeup into the pokes that we have all over the face. I'm always trying to think infection control. I want to keep things clean. I want you to sleep on your back, a little elevated. That's going to help with your swelling. If you are sleeping on your face, you're going to mash it and you're going to be really swollen the next day. So don't do that. I also want to make sure, like I said, you don't need to touch it. So this product, it's moldable, it's a gel, and it's moldable for up to a month. So if you are doing gua sha, massage, facial, you're potentially going to displace this. We don't want that. Don't do that. No workout. Give me like at least 2 to 3 days. Like you can walk. I don't want you getting super sweaty. I don't want you going to a sauna. So try not to exercise right now. When you go back to your exercise, I want you to take it easy. I don't want you to like have your most aggressive workout. After your workout, if you are a little swollen, ice your face. It's gonna help temper down all of that swelling. With your filler, when we're doing this safety-wise, what we want to make sure is that we're not blocking blood flow off. We're going to let you know before we inject and while we're injecting what signs we want you to be mindful of. So we have blood vessels all over our face, all over our body. We never want to put too much filler in any spot that blood can't move, can't flow like normal. So we're looking for your skin color to be normal, not any paler than normal. It shouldn't have any extreme pain. You shouldn't have any vision issues. If you had any of those signs, somehow it could mean we're blocking blood flow from moving like normal. In that instance, we would dissolve it. So in my entire career, I've been doing this since 2013, so 12 years. I've never had to dissolve anybody for any emergent reason. So this is really rare. However, these are the precautions, these are things that can happen. We want to be mindful of it. I ask that you stay in town for a day. I know we have patients that fly in every single day for treatment. I just don't want you to jump on the plane and be gone. If it were ever an emergency, our team, we want to be able to take care of you. Okay, so if you ever had any concerns about any of this, call us, text us, our team, we are on the phones, we're here to help you. I never want you going home and feeling like you don't remember something or you don't know what to do. Like, you're here to be supported, and so you're not on your own trying to navigate this. So if you're watching this and you think it's time for cosmetic injectables, some Botox, some filler, call us, text us. We can get you set up with a consult with me, my team. We would love to see you and take care of you. Thanks so much for watching this video. Like and subscribe, and when you're ready for yours, come see us.